Beyond injury, beyond acceptance and work and recovery, there is hope. There's the strength of the human spirit and the will to maximize physical potential. There is Beyond Therapy.
To me, Beyond Therapy is an intense activity-based therapy program in which we try to re-educate an injured nervous system by providing a variety of sensory and motor stimulation in hopes of reactivating and reorganizing central nervous system.
It's basically activity-based, training someone as an athlete, pushing them to their limits both mentally and physically.
In Beyond Therapy, we use stimulation, repetition, and physical exertion to encourage the concept of neuroplasticity.
Neuroplasticity is the ability of the nervous system to modify itself, either grow new connections or change the connections between the brain and the spinal cord and the muscles or the sensory receptors to improve function. What we're trying to do with activity-based interventions, such as the FES bike or locomotor training, is give lots of sensory and motor input to the system so that we drive those changes.
It starts with overall physical wellness, making sure the body is ready for the intense activity to come.
We're going to focus on cardiovascular strength, endurance, all different parts that make up wellness.
The fact that if we put load and we exercise the limbs, we can change bone density has been shown, and also that the activity will improve the blood flow. So that's the health and wellness piece that I think almost anybody will achieve.
Most people progress quickly to the physical enhancement program with 9 hours of workouts a week, customized to each client, facilitated by experts, and utilizing the most advanced new therapies in rehabilitation today.
Core strengthening comprises a large part of this program so that your body's strong enough to support itself in whatever environment you're in.
Lifting weights, using resistance bands, that can really help bone density as well, so that's a big thing. Help ward off fractures. A stability ball will go ahead and provide you with an unstable surface, and from that aspect you can go ahead and have a patient complete a task or an exercise, and it's more difficult than it would be if they were lying or sitting on a fixed object.
Traditionally, after rehabilitation, there's no more therapy offered, and yet this kind of intense therapy can build strength. It also has the potential to increase function and prevent the health risks and treatment costs that come with secondary complications. So over a lifetime, the cost of care can be reduced.
On the mat, I can sit up on the mat with my arms behind me and support my weight, which when I first started Beyond Therapy, I couldn't barely sit up and hold my head up.
We try to get them to tolerate vertical at the highest point possible, and after that, then we try to incorporate exercises.
We have such an accessible pool and such a knowledgeable staff that we are able to do some core strengthening in the pool as well as on land, which I think is an advantage to our program.
I love the pool, the warm water, and walking in the weightlessness is not only good for me, but inspiring for me.
I love the FES bicycle. It gives us an opportunity to pedal a bicycle with stimulation or without stimulation. It depends on your level of injury, and it depends on the extent of your injury.
So we attach electrodes to your quadricep muscle, to your glutes, and to your hamstring muscle. They allow the quads, the hams, and the glutes to be stimulated at the appropriate times to actually pedal a bike. BioNS is another great tool of our program. It's an orthotic device that's applied to your arms.
It's an e-stim unit that can get into the hands and get finger extension and finger flexion.
The Giger is great because it allows you to passively move all the joints in your body as well as strengthen by adding resistance. It gives you a good cardiovascular workout, but one of the things that I enjoy most about it is that it allows me to decrease the patient's tone or spasticity as well.
When I'm on it, I can't propel it by myself, so I have to have assistance. But I just concentrate, and I've gotten a lot stronger since I've done that.
The Locomat is a wonderful part of our program. It allows somebody to walk over a treadmill even if they don't have any movement in their legs.
When I use that equipment, I'm using a natural walking motion. It strengthens my calf muscles, it strengthens my ham and my quads.
For those pursuing experimental protocols, an activity-based program is often part of the doctor's orders. The Beyond Therapy staff will help you with everything from pre-surgery research and testing to post-surgery therapy.
Even if you have the pathways opened up from that experimental surgery, the only way that your body is going to know how to reorganize them and re-educate them is through activity, is through working out and getting stronger.
Whether someone has an experimental procedure or not, there's compelling evidence that the intense activity in Beyond Therapy works. Progress is measured quarterly and documented thoroughly. But for the ultimate proof, all you have to do is ask our clients.
When I started the program in October, I could not stand even assisted. I couldn't stand because I was, number one, my muscles were weak and I was too large. I needed to lose weight. And so far I've been able to lose pretty close to 40 pounds. My trunk strength has increased. I'm able to lean forward in my chair and straighten myself back up. I'm able to pick things up that I drop on the floor. My blood pressure has gotten stabilized a lot better. I've just always believed throughout my whole life, if you don't put anything into something, you won't get anything out of it. And I'm going to put as much as I can into the Beyond Therapy program.
Before I started Beyond Therapy, I had problems just sitting up in my chair without getting dizzy. I couldn't move my shoulders at all before, and now I can do shoulder shrugs, and I've gained 20 pounds. My quads are 2.5 inches bigger than they were before I started. I'm with therapists that actually, they care about their jobs, and you can tell that they love what they do, so that makes it a lot easier, and it's fun. It's hard work, but it's also fun at the same time.
That is so cool. Yeah.
I was really locked in a fetal position when I started, and man, was I a tough case. I've progressed to where not only can I support my weight, the spasticity's under control, and I'm walking. As my legs have gotten stronger, the spasticity's gotten less, and we're now backing down the medication in the pump. It feels great for people in Beyond Therapy to share in your joy in your recovery, because they do.
When one person down there have a success, I think all of us kind of enjoy that and buy into it, because when one is able to do something, it encourages us.
I just like seeing the smile on people's faces that, after they've done something that they didn't think they could do.
Other places are going to have locomats. Other places are going to have Geigers. They're going to have pools. The difference in our program versus someone else's is the staff and what they bring to the program and what they are going to bring to each individual who's on the locomat.
You can start today and put yourself in an environment, and Shepherd's one of those environments. Shepherd's one of those environments that says, yeah, you can get better. Yes, you can have a life.
Beyond injury, there is hope and help and healing. Beyond injury, there's an opportunity to explore new horizons in neural recovery through Beyond Therapy.